So good afternoon. Today, the Lieutenant Governor and I are joined by Secretary Sudders and Secretary Theoharides to discuss a testing update and details around a newly launched food security task force program to offer increased access to food and resources for individuals and families here in the Commonwealth. As of yesterday, 8,188 tests were reported in Massachusetts. That brings the total number of tests conducted in the state to 540,561. The average positive test rate is down to around 9%. It's been pretty much in that general vicinity now for about a week. 2,179 people are hospitalized for COVID-19. This represents a significant decrease over the course of the past 2 or 3 weeks. With phase one on the reopening now underway and more sectors in our economy slowly reopening, this data indicates that we are trending in the right direction. The progress that we've made has only been made possible by everyone's willingness to do their part to practice social distancing, wear face coverings, wash their hands, and play with purpose on this one. We all have a responsibility to continue doing these things. The science on this is pretty clear. These things done together are highly effective. And this is how we will continue to fight the virus and at the same time reopen responsibly. Workers on the front line are still using up PPE, and we're working hard to get more into the hands of healthcare workers and law enforcement officers throughout the state. Over the weekend, the total amount of PPE we've delivered rose to over 12 million pieces so far, including masks, gowns, gloves, and ventilators. To help businesses and other organizations reopen, we also launched a listing of places they can buy things like face coverings, hand sanitizers, and gowns. Coveralls as well. Many of the vendors on that list are Massachusetts companies and are getting into this market thanks to the support from our MERT program, and it's a great program, and we hope to see it continue to grow. I do want to say that we've had daily conversations with the healthcare community and the hospitals across the state, and we've talked a lot about preparing for and dealing with the surge, which is now something that, thanks to a lot of work by a lot of people, is behind us, and as a result of that, many of the field hospitals that we set up around the state to add beds and reduce strain on hospitals have begun to close. We've had many conversations with Boston Mayor Marty Walsh and his team, and with the Mass General and the Brigham and Women's Hospital and Boston Healthcare for the Homeless and Boston Medical Center about the 1,000-bed Boston Field Hospital, Boston Hope, that we stood up at the Boston Convention Center on April 10th. In the past several weeks, Boston Hope has treated more than 700 COVID-19 patients on the hospital side and has also served as a respite site for homeless and housing insecure folks on the other side. And we're grateful for the partnership and coordination that went to standing up this facility, and are especially thankful for the many folks who worked to take care of the folks on both sides of that operation. Today, in partnership with the mayor and the city of Boston and with Mass General Brigham, Boston Hope has announced that it will suspend the acceptance of new admissions as treating patients at this alternative site is no longer necessary. However, the facility will remain in place until all existing patients are safely discharged, and the beds there will be available at the facility throughout the summer should we need it. I also want to thank the men and women of the Mass National Guard for all they did in stepping up and helping us establish Boston Hope at the BCEC in the first place. Another big piece of fighting this disease going forward has been testing, and as we continue to expand testing throughout the Commonwealth, we joined Mayor Dan Rivera up in Lawrence last Friday to announce that the City of Lawrence is building out capacity along with the Greater Lawrence Community Health Center and Lawrence General Hospital to test 1,000 residents per day there. Greater access to viral testing helps us and them better understand infection rates and who is infected with COVID-19 so that we can help those that have been affected self-isolate and be supportive of them and to stop the spread, and also reach out to and help their close contacts. And by partnering with private and commercial labs like Quest, LabCorp, and the Broad Institute, we've significantly increased our testing capacity here in the Commonwealth. We've also received tremendous support from companies that supply testing platforms and reagents to our hospitals and labs across Massachusetts. Hologic, which is a Massachusetts-based medical technology company, which is located in Marlborough, is supporting the Lawrence Initiative by shipping 15,000 tests to Lawrence General Hospital. This will allow Lawrence General Hospital to process tests on site, providing quicker turnaround time so patients know if they're positive for the virus or not sooner. Statewide, we currently have the capacity to test around 30,000 people per day. We've established a growing network of over 260 testing sites statewide, and we remain a top 5 player in per capita testing across the country, and we plan to do more. Last Friday, we released a request for potential vendors to help scale testing more broadly here in the Commonwealth. The competitive bid calls for proposals for both mobile testing and site-based testing vendors for our Strategic Testing Expansion Program, otherwise known as STEP. Through STEP, we'll prioritize expansion of testing sites in areas that have the greatest need and ensure that each region in Massachusetts has reasonable access to testing capability. By the end of the month, we plan to submit a plan to the federal government for our long-term strategy for testing, and that plan will include assistance to boost overall testing capacity to 45,000 tests per day by the end of July and 75,000 tests per day by the end of December. Expanded lab space, expanded testing for high-risk settings like state hospitals, group homes, and correctional facilities, a reduction in the turnaround time from the point of testing to test results delivered, and expanded randomized testing for surveillance purposes across the Commonwealth. And as we work to mitigate the efforts of this pandemic, this effort and these initiatives will be crucial. Now, with respect to food security, COVID-19 has affected all of our lives and has had a statewide impact, but some of our communities and residents who've historically experienced greater food insecurity have been made even more disproportionately impacted by the virus. A little over a week ago, we announced a $56 million program to combat urgent food insecurity for some Massachusetts families and individuals as a result of COVID-19. That funding was a recommendation of the Food Security Task Force we convened last month. The task force was established to provide more access to food assistance during COVID-19 and is comprised of a broad group of public and private participants. Secretary Sudders and Secretary Theoharides will go into some of the details of the task force and their efforts shortly. This funding will jumpstart some of the task force's recommendations to address urgent needs and food supply chain issues that have been exacerbated by the pandemic. These funds build upon other critical COVID-19 resources that we're distributing in partnership with the legislature, including the $502 million in federal coronavirus relief funds to support important municipal initiatives, many of which involve things like food assistance during this public health crisis. Increasing food security is essential to protecting the health of the people of Massachusetts. Our goal is to use this funding to meet a greater demand for nutritional assistance among vulnerable populations and those struggling with the economic impacts of the pandemic. The funding will go toward a $36 million food security infrastructure grant program for individuals and families to have access to food through innovative solutions. Secretary Theoharides will talk a little bit more about this in a minute. $5 million to increase our Healthy Incentives program to meet increased demand for local produce and to increase access points that process SNAP and HIP benefits. $3 million in funding as an intermediate relief program for food banks, $12 million for the provision of 25,000 family food boxes per week through a regional food supply system. Each family food box contains about 30 to 35 meals. Those food boxes will be distributed throughout the state, and that work will continue throughout the summer as needed. For the past 6 weeks, we've supported a similar food distribution effort in Chelsea to help support that city with providing food security for its residents in the wake of the crisis. Working with the city, the Mass National Guard, the Salvation Army, and MEMA, 10 food distribution sites supported approximately 9,000 residents each week. The ongoing crisis has also highlighted the importance of reinforcing Massachusetts' local food supply chain and this investment will provide needed capital to the farmers, fishermen, food banks, and distributors that are helping the Commonwealth respond to this unprecedented public health emergency. We'll continue to bring every resource the Commonwealth has to bear in this fight against COVID-19, and the work with the Food Security Task Force and our partners in the legislature to address food security issues on a go-forward basis is critical to ensure that every family and individual in the Commonwealth has access to food during this time. I hope we never have to use all the resources we're putting together on this one, and so far we've successfully met the needs of a small number of communities who've reached out for assistance, but we have to prepare, as we have all along, for the worst, and there are so many amazing organizations out there that are being called upon to serve more and more people during this time. These groups have to have answers for those calls, and this program is in part about making sure they can continue to do so. Now I want to turn it over to Secretary Sudders, who can discuss the work of the task force and highlight additional ways we're working to provide families with benefits for what has been an extremely trying time for many. Secretary?
Thank you, Governor, Lieutenant Governor, Secretary Theoharides. Good afternoon, everyone. A couple of updates from the command center. And in fact, Governor, as you were announcing, building upon the success of Chelsea and the food boxes, in fact, this week, the first set of food boxes are being delivered to all 4 food banks this week. As you heard, the economic impact of COVID-19 has reached all corners of the Commonwealth and heightened food insecurity among many communities and vulnerable populations. Long-standing food assistance programs, including the Supplemental Nutrition Assistance Program, otherwise known as SNAP, and Women, Infant, and Children's Program, the WIC program, have been experiencing significant increases in applications. In addition, community-based food banks were experiencing skyrocketing demand, and local grocers and farmers were struggling to meet the needs of consumers. Recognizing the need to act, in late April, the COVID-19 Command Center convened a food security task force representing public agencies, the legislature, and private partners. The work of the task force is built on Massachusetts' long-standing initiatives to increase access to food, including establishing emergency food distribution sites and school meal sites for food distribution. We implemented the pandemic EBT to provide food to 500,000 youth who usually receive free or reduced price lunch, and distributed additional SNAP benefits to households. We requested online EBT purchasing approval from the federal government and streamlined the food benefit food administration program administration. The task force recommendations had 4 key actionable categories. In fact, we saw this as a bridge. Develop and implement an emergency food program, fortify the food bank system, maximize every federal resource, and reinforce and redeploy the food system infrastructure. I'm deeply appreciative of the task force's practical recommendations so that we could start meeting residents' immediate needs and work towards longer-term solutions. As I said, I'm pleased to announce that building upon the success we had in Chelsea with food boxes, that the first set of food boxes are being delivered to all 4 food banks. The work of the Food Security Task Force continues as a private-public partnership chaired by Energy and Environmental Affairs Secretary Kathleen Theoharides, Department of Transitional Assistance Commissioner Amy Kershaw, and Jill Shaw, the president of the Shaw Family Foundation. On a parallel track, the Commonwealth's efforts to deliver food benefits have been operating with flexibility to ensure that eligible families and individuals receive these benefits, to many a lifeline to nutritious meals. One such flexibility that we pursued and were recently granted was for participation in a pilot that allows SNAP EBT purchases through approved online retailers. As you know, federal SNAP rules generally prohibit online purchases with an EBT card. Now that the approval has been received, we are working rapidly with the state's EBT vendor and the 2 retailers who have been approved to participate in the federal pilot program, which are Walmart and Amazon, to start operations hopefully by the end of this week. Additionally, we are implementing a special food benefit for children called Pandemic EBT, or PEBT, which, as I said, delivers to the household of 500,000 children who received free and reduced price schools across the Commonwealth. The benefit provides direct financial assistance to purchase healthy foods for families with children who would have otherwise received free and reduced price meals, if not for school closures. These payments supplement the more than 1,500 district grab-and-go meals that are available throughout the Commonwealth. Households receive $5.70 per child per school day for the duration of school closures. It represents about $28.50 a week. This brings also about $200 million into the Commonwealth's economy, supporting our local grocery stores, corner stores, and their employees. Existing DTA client households with eligible children actually began receiving PEBT earlier, and new households will be mailed a unique benefit card this coming week. More than 263,000 households have received the benefits since last Wednesday. A big part of the work is to make sure that eligible families know about the benefit and how to use it. A partnership of the Shaw Foundation, DTA, and Project Bread launched the masspEBT.org to get the word out. Late last week, we launched a series of PSAs featuring the First Lady, Lauren Baker, and Wally the Green Monster to raise awareness of the food benefit. We needed Wally to do something. Customer support for PEBT participants is provided by Project Bread. Food insecurity is not going to be solved overnight, so our work to help meet the basic needs of Commonwealth residents will continue. Before I turn it over to my colleague, just want to remind individuals that tomorrow in the press, that tomorrow we'll be providing additional information about nursing homes. We'll be updating our fact pack with more granular data, as well as the results of the testing protocol, where the deadline was May 25th. And with that, I'll turn it over to my colleague.
Thank you, Secretary Sudders, and thank you to the Governor and Lieutenant Governor. Increasing food security and resiliency of our food system is essential to protecting the health of residents of Massachusetts. During this public health emergency, we've seen an increased need for nutritional assistance among vulnerable populations and those struggling with the economic impacts of COVID-19. At the same time, we've spoken with many farmers, fishers, and other local producers who have lost major institutional markets and are struggling to plan for the growing season ahead due to uncertainty around these markets, available labor, and their ability to distribute and sell food. The ongoing crisis underscores the importance of strengthening our local food supply chain and ensuring that the food grown and produced here in the Commonwealth can reach all of our residents, especially those who are currently food insecure. Massachusetts is blessed with a rich and diverse supply of food, local food, from almost 500,000 acres of family farms and local growers to some of the most productive fishing ports in the country and a growing aquaculture industry. We are fifth in the nation for direct market sales from our farms, and it's no surprise that during these challenging times, many farmers and fishermen have been finding ways to adapt to changing patterns of food demand this spring. Now is the time to build on these strengths. The Baker-Polito administration is committed to supporting our farming and fishing families while helping families throughout the state access fresh local food. Last week, as part of the overall effort to address food security Secretary Sudders described, Governor Baker announced the creation of a $36 million COVID-19 food security infrastructure grant program to both make investments in creating a resilient local food system and ensure that affordable, nutritious food reaches residents in need across the Commonwealth, not just during this crisis, but over the long term. The program will provide grants of up to $500,000 to producers and participants in our local food production and distribution system, like farmers, seafood businesses, retailers, food pantries, and distributors, to help them adapt to disruptions in the supply chain and fill infrastructure gaps so that we can ensure food is reaching residents across the Commonwealth. The grants will fund investments in technology, equipment, increased capacity, and other infrastructure to help producers distribute food, especially to food insecure communities, with a focus on addressing unique challenges in gateway cities, rural communities, and other hard-hit areas. Potential projects may include grants that support community gardens and urban farms and provide other equipment to grow food in urban settings, construction of food processing facilities, equipment for sanitation, remote ordering and payment, and curbside pickup, and payment equipment necessary for producers to accept healthy incentive program benefits. To facilitate the grants process and disbursement of funds, the Executive Office of Energy and Environmental Affairs is working with a diverse cross-agency team, including the Department of Transitional Assistance, the Department of Public Health, the Department of Agricultural Resources, and the Department of Fish and Game. We plan to post the grant request for responses in early June, and applications at that point will be accepted on a rolling basis and will be reviewed and funded in a competitive ranking process. We look forward to seeing the innovative ideas to help our producers better connect food supply with demand and to address areas of food insecurity across the state. Farmers, fishermen, food banks, and distributors have been critical in helping the Commonwealth respond to this unprecedented health emergency. We look forward to rolling out this program so we can work together to provide healthy, local food to those who need it most now and in the future. I'd like to thank the Food Security Task Force members. They worked very diligently over the last few weeks to come up with these recommendations. Also to my fellow co-chairs, Commissioner Amy Kershaw of DTA and Jill Shaw of the Shaw Family Foundation, as well as the Massachusetts Emergency Management Agency. Thank you to Secretary Sudders and the Governor and Lieutenant Governor for their leadership on this issue, and I'll now turn it back over to the Governor.
Do you have questions on the food stuff first? Just because if you do, we should have the two people who know more about it than we do.
Governor, on the food security, what areas of the state are seeing the biggest challenges?
You know, honestly, I would say that geographically it's pretty much one end or the other, but it's in spots. And I will let Secretary Sudders or Secretary Theoharides speak to that.
So you see it, of course we see it in gateway cities, but you actually do see it throughout the Commonwealth in pockets. Obviously there are parts of central to western Mass, but in particular we see it through the gateway cities. One of the reasons we really wanted to work with the 4 major food banks was, since they all have regional distributions, is to really work with them, through them, to get to the communities that they're hearing from. So like the food boxes, which was very successful in Chelsea, which is, you know, every box is like 30 to 35 meals. Those go out to the 4 major food banks, and then they distribute it out through the regionals. It's a very efficient way for them to be very connected to the local municipalities who have the need.
You know, one of the things that I didn't fully appreciate when we first started having these conversations was many of the folks who man a lot of the food banks are volunteers, and they take like the big crates of food that they get and break them down so that they can actually be distributed at a retail level. And those volunteers in many cases are older and they're retired, and they got really worried about COVID-19 and spending a lot of time away from their home and putting themselves in positions where they might contract the virus. And so a lot of these food pantries and distribution centers lost one of their major assets, which was volunteer support when people started to get nervous about contracting the virus. The other thing that happened was many of them also rely, and have always relied, on overages at restaurants. Well, guess what? We pretty much, for a variety of reasons associated with COVID, shut down the restaurant industry, which took away a major source of supply for them. And it's not a secret that we've had issues nationally with respect to our food supply and our food chain generally. And the more we can do to pump up the volume on our local suppliers and our local farmers, the more likely we are to create a robust system that can work its way through some of this difficulty.
As far as the $36 million fund, it strikes me there would be a lag time to get, find out what the producers need. And can this be done quickly enough and efficiently enough to help the people who are going hungry at this point?
Yeah, that's what you answer. Yeah.
I will let my colleague talk about the $36 million, but there are other pieces to the full package that we put out, which was worth about $56 million. $52 million. So one are the food boxes. That's immediate. So that's like immediate in families' hands and like. The other is an increase to the HIP program, which increases EBT cards if you use them at farmers markets. Again, that's like quick in your pocket out the door. And then the $36 million, which I'll let, she has the great opportunity to work with a number of fishers, urban farmers, and the like to really then build up an infrastructure. So if you think about out of the box is the food boxes, and then increasing the HIP for individuals to be able to use farmers markets, and then the really innovative bridge work is through the $36 million, which I'll turn over.
You should also mention the pandemic EBT is already
All right, and I only said it twice today. And the pandemic EBT card is obviously money directly in families' pockets to buy food for their families.
Secretary, can you elaborate on the online EBT waiver from the feds?
How heavy a lift was that for them to do that? I mean, I doubt they wanted to do that at the federal level, did they?
The federal government on both the PEBT and flexibilities, giving states flexibility, has actually been, both on mass health and for DTA, has actually been fairly easy. I mean, not easy, but facile to get through. And it was a pretty clear template for you to apply for. So it was not, it's a pilot, it's only 2, right? It's only Walmart and Amazon. Now that's big. And I think the fact that the federal government understood that states need flexibility, and individuals who are disabled and the like, the difficulty in shopping. So we pressed hard for it, got it, and the other good news was we use a third-party vendor as the connection for us, called Conduit, for our EBT cards, and we're testing it. We got approval, I think, last week. We're testing it now and hoping to go live on Friday. So it was, it's only as good as the pandemic, though. So these are the kinds of flexibilities I think we would like to see if it works well, the pilot works well, is the kind of thing we would want, sort of a longer-term waiver with the federal government.
I thought that was supposed to take months, though. Wasn't that the estimate before? What changed?
Yeah, so we, as there are 2 national vendors, then the vendor we have, so the other national vendor was approved first. And so we've been sort of watching what the issues were, so not just waiting for approval, but seeing what the other states' experiences were and getting it set up. So the minute we got the approval, we sort of worked with our vendor to start getting the capacity ready for tests. So we've been on an accelerated testing process through the 28th in order for us to really, we're hoping to go live on Friday. Yeah.
Secretary Sudders, regarding the PEBT program, 2 questions. One, can you repeat what the 200,000 figure was? Was that related to PEBT? And then also, when you first announced this, you suggested or projected that this could generate more than $100 million into the Massachusetts economy while, helping families in need. Does that still sound right, or what is your read on the bigger picture, the economic impact right now?
Sure. So the pandemic EBT is to provide food to 500,000 youth, and they're served 2 sets of families. So families who have had EBT, so they know how EBT works and the like, and then families who've become newly eligible as a result of becoming unemployed and the like. And that's sort of 230,000 family. And the numbers that I have from my staff, so I will tell you that I don't go deep into the detail of the money, but my staff actually reporting now is that they believe that it will bring $200 million. So initially we thought it'd be $100 million. We're thinking now it's about $200 million into the Commonwealth's economy. And again, it's $5.70 per child per school day for the duration of school closures. And it's about $28.50 a family. So it's real. And to go to your question, it's like real in people's pockets now. Yes, sir.
Although I'm still a little...
presumptive eligibility to FEMA too, which made that
Well, I'll let you.
So one of the other elements of this that the feds were helpful on was granting a number of states, including Massachusetts, presumptive eligibility for access to a lot of the food that was made available under the emergency declaration through FEMA, which gets federally reimbursed at 100% with that presumptive eligibility, and that was a big deal too. And they turned that around in about a week. They've been pretty good on some of this stuff.
So can I ask, that sounds to me like something that producers are going to get as opposed, I mean, that's for farmers, for fisheries, for people like that. How quickly can that be, how quickly can they get that money to do what, and to do what with it?
The 36 million?
36
Yeah, you should speak to that, Secretary.
So it's a good question, and to a certain extent the timing is on our side a little bit here because it's not the harvest season yet. And so some of this is getting things in place like cold storage for fishermen so they can store fish, sell them off their boat, be more flexible in terms of the direct to market salability of products. I think the other thing is with this resiliency fund, we're looking to help right now in this current crisis, but also to scale beyond this, so that we're looking at investments that will help now, but will also help build a really resilient food system through the future. But I do think the projects that are going to be scoring well in this grant process will help now and will help in the longer term as well.
Are they grants or loans?
They're grants. They're grants.
Governor, I have a question about restaurants and roles on that.
Okay.
As you consider when to reopen, are you looking or considering outside dining only, or is it possible to do indoor and outdoor, first time they're allowed to reopen?
So there's a lot of conversation going on between the task force that the Lieutenant Governor set up on restaurants and tourism and accommodations and the folks at Public Health. And it's not just inside Massachusetts. They're also talking to people in other states. I mean, one of the benefits, to the extent you can call this a benefit, about being a little bit behind some of the other states that weren't hit so hard by COVID-19 is they are starting to have experiences with some of these reopening initiatives, including stuff around restaurants, and we're able to talk to them about their experiences and what they've learned from it and make adjustments to our own stuff. And the other thing they've been doing is talking a lot with our colleagues in local government, because restaurants in particular are one of those things that has a lot of local oversight. That's not just a state issue.
Governor, can you tell us, were state leaders made aware of this situation early after Polio was over his home? And did state leaders provide guidance?
So what happened at Holyoke remains a tragedy. And we hired First Assistant Mark Perlstein within 2 days of being notified about what had happened there to do an in-depth investigation. And I'm uncomfortable speaking to the specifics of this until he finishes his report. He's interviewed many people. He's looked at thousands of documents. We did move when the Lieutenant Governor and the Secretary and I were made aware of where this whole thing was on a Sunday night around 10 o'clock. By 8 o'clock in the morning, we had the National Guard, an interim superintendent, and a series of epidemiologists from DPH, and eventually folks as well from Holyoke Medical Center, who came on to stabilize the operation there, and Val Liptak and the Guard and the other folks who have been there since then have done a really terrific job of dealing with a really terrible situation. But I'm waiting for Mark's report, because I think there's a lot of back and forth on what happened, and that's understandable given the enormity of the tragedy there. But I'm waiting for his report.
And Governor, how long until we see that, or how long until it's expected to be completed? Any general timetable at this point?
I think it's going to be done reasonably soon.
Governor, could the Lieutenant Governor address, there are some photos floating out there on social media about some sort of party. Did the Lieutenant Governor have any sort of gathering, or a family member have any sort of gathering kind of home? If you could just address that.
Happy to. I think you're referring to a blog post made over the weekend, and the answer is no. I did not host a gathering at my home. My brother, he's one of the parents in our Commonwealth that has 2 children graduating, one high school and one college, and he invited some family to get together. I did stop by to say hello. It was an outdoor gathering. When I was there, it was spread apart, social distancing, which is allowed under the governor's order and with the social guidance that we've issued. And I would just say that this is going to happen when people want to get together, and as the weather improves, it's a natural thing to want to do, and should be done in a manner where people come together, practice social distancing, and keep it small, which is what happened with my brother's family. Thank you.
Governor, on the bars and restaurants issue, some owners are asking that they be allowed to do cocktails and liquor to go. Is that something you consider to help them jumpstart their business?
Well, we did do, with the help of the legislature, we did get legislation passed that said that on takeout and delivery, people could sell capped, shut bottles of wine and, I think, beer, right?
I guess they want to go a step further than that.
Well, anything beyond that would require legislation. And I don't think there's anything pending on that at this point.
Can I ask you, sir, about the barber shops opening up this weekend? We've done some of the retail drop-off stuff. How do you think it's going?
So, for the record, Jonathan was the first person to ever ask me about barbershops and hair salons. I remember.
Still don't have a haircut.
And you look great.
Are there any issues so far with the reopening, do you think?
Well, I can tell you this, that the vast majority of the feedback, and it's a big community. I mean, there's 41,000 licensed barbers and hairstylists in Massachusetts. The overwhelming sense we've gotten from the folks in local government, who are primarily the ones we've talked to, is that as the process so far has gone as expected and anticipated. And I can tell you that at 7 o'clock this morning, I got my hair cut, and I showed up at 7 a.m. They took my temperature. I had to sign an attestation with respect to a variety of things that I said I didn't do and haven't done. The place where I cut my hair, or where I've gotten my hair cut, had plexiglass between the chairs. I had to wet my hair before I got there. I wore a mask the entire time. The gentleman who cut my hair wore a mask the entire time and a gown. And I was out in 20 minutes. And I would expect that that is a fairly similar experience to the one other people are having.
And how about the beaches over the weekend with the gatherings and stuff? Did you see any crowding or any issues?
Well, we talked quite a bit about that, and we think we got some cooperation from the weather for the most part. It wasn't the kind of weekend that people usually hope Memorial Day is. And I think our beaches, anyway, you felt pretty good about, didn't you? Well, you need to.
I think we saw good cooperation from beachgoers this weekend. People were wearing masks where social distancing wasn't possible. They were staying spread out along the beach. I was in Revere on Friday, and that was a bright, sunny, beautiful Friday of Memorial Day weekend. And you could see on the sidewalks people were distancing, people were spread out along the beach. And the mayor reported, usually the Friday before Memorial Day is very busy, but this was a much more controlled, small crowd on Friday. So we appreciate all of the cooperation we've gotten from beachgoers and parkgoers across the state.
And the parking lots are all open now on all the state beaches?
We are opening DCR parking lots in consultation with the municipalities. So in the city of Boston and the city of Revere, we are not opening parking because the crowd volume has a tendency to get high there. But at many of our other beaches, we have reopened parking. But it is very important that it's a state and municipally driven discussion about what we're doing with parking.
Phase one in general, are there any tweaks that you are foreseeing? And then how are we on target for phase two?
Well, obviously, the big issue with respect to moving from phase one to phase two, or from phase two to phase three, is pretty consistent here in Massachusetts with the way they're doing it in most places, which is it's going to be based on the scoreboard, the data that we look at each day with respect to testing results and hospitalization rates and healthcare capacity and sort of the main elements of how we doing and what's going on. And that data, obviously, we report every day, and everybody can see it on the fact pack that gets put out by the command center. But that's really going to, in many respects, drive a lot of the decision making around when you move from one phase to another. As we said in the reopening report, and I think as a lot of other states have said, the other thing I would say is that these folks are still working on industry protocols. And as they develop protocols, they're going to make them available so that people have time, if they're in phase 2 or they're in phase 3, to review those protocols and figure out how they would comply with them by the time we got to phase 2 or phase 3. Because they do want to give people lead time to take a look at that stuff.
Governor, feeling good right now about the transition? You feeling good?
Some states have seen a bit of an increase since reopening. What's the plan to, if you do see those numbers start to go up, first of all, is the testing and tracing program here up to snuff enough to capture that and to be able to contain any sort of spikes?
Well, I think one of the reasons we went down the road of creating a tracing program in the first place was so that we would be able to reach out pretty quickly to people who tested positive and to their close contacts. And I don't remember the numbers at this point. I think they've reached out to more than 30,000 people who've tested positive. I think they've connected to something like 2/3 of those folks and then to about half of their close contacts. And have referred people for services and are providing support for folks who are in isolation. The main element of creating a tracing program and ramping up testing is to continue to do the things that have been proven over time to keep the reproduction rate, how many people who get the virus pass it along to somebody else, below 1. And it depends upon whose model you look at and how you calculate it, but we're basically either at or below 1 in most of those models at this point in time, and we need to stay there.
Governor, as of Sunday, the state had not lifted the ban on visitors to hospitals. Any idea when that might be lifted?
That's been an ongoing conversation for a while with the Medical Advisory Board. I think, there's a lot of things about this that nobody likes, and I completely get it. One of them is visitors to hospital. One of them is visitors to senior care facilities. That one's personal for me, and for many other people as well. I think you folks are making some progress on this one, and we may have more to say about it. June 1st, is that what you said? It's a complicated issue, okay? A lot of psychological benefit in it, but big concerns about some of the issues associated with the virus.
As we've said before, ending visitation in both hospitals and long-term care were among some of the hardest decisions we need to make. As a social worker, I actually wanted to open visitation sooner. And as we opened up phase 1, which is only a week old, there was a request for us to open visitation for hospitals. And in consultation with the Medical Advisory Board, we feel like we want to see how this first phase goes for a couple of weeks, how the hospitals will respond, as we opened up other procedures and immunizations and pediatric care, to see how that works, and then look at reopening visitation in both hospitals, and we're actively looking at opening up outdoor visitation for long-term care residents. So I would say we like data, not dates, as you know, but I sort of said give us a couple of weeks to see how in increasing services in our hospitals and in pediatric practices. Let's see how that goes for a couple of weeks, and then cautiously look about opening up visitation, and again, under very, very strict protocols. So it's top of our mind.
Secretary, could I ask you a question while you're there? You mentioned you might have some more information about nursing homes soon, but...
I was just looking to see if you were paying attention, Bruce. Just checking.
You released some information last week. How did you interpret that about infection efforts at nursing homes?
The first set of audits. And actually, so which data? As you can tell, I live in data. So the first set of, just to anchor everybody, so the second $130 million package for long-term care facilities is predicated on many things. One is a baseline audit that then we will audit every 2 weeks on a 28-point checklist, as well as the second piece is by May 25th, nursing home staff and residents have to be tested. And the threshold is 90% of the residents, 90% of the staff have to be tested. And that was as of yesterday. And that's the date I'll release tomorrow. When we put out the checklist and the audit, there was weighted average. There was several of the items, five questions or items on the checklist were weighted heavily. And if you didn't pass one of those, if you weren't successful, you automatically failed, if you would, got a red light. I'm expecting, and I understand that the audits that have occurred to date for the second round of audits, that there's been significant improvement, particularly in the issues of PPE and infection control. And we will be releasing the second round of audits, I think that's next week. So they're every 2 weeks. So last week we released for the first period. This is the second week of the next round of audits, and next week we should be releasing those as well. And we have seen, so I was looking at data for I think a third of the nursing homes, and you see significant progress.
Do you feel like the problem in nursing homes is under control now, or are you trying to figure out what's the problem? Do you have any sense of that?
So I think I feel that the process we have put in place with the nursing homes and the nursing home industry around the issues of infection control, PPE, staffing remains a challenge in nursing homes. It existed before the pandemic and certainly during the pandemic if people test or are close contacts and then are out for 14 days. I think that we're in a process of really understanding what the issues are in nursing homes and putting the processes in place to stabilize, but not just stabilize, but to move forward. So I think that this is very much a work in progress. I feel that making the information public is very important to whatever the reforms are that we need to have for our long-term care community, and to keep patients safe, to help staff feel safe and want to work.
Governor, the menthol cigarette ban goes into effect on Monday. Things are a lot different from when you signed that bill as far as the black market and travel to other states where they are available, not to mention just the health impact there and everything. And tax revenue, also a very different picture. Any new thoughts, or should that go into effect June 1st the way it's law?
Oh, I think it should go into effect. It was a public health issue at the time, and it was particularly important to a number of folks in the public health community and to the Black and Latino Legislative Caucus and the leadership, and we supported it and we signed it, and we want to see it go into effect.
Thank you. Did you know Donna Marcel?
I met her my wife is on the board of the Red Cross and has been for years, and we got to know Donna, who is basically a head of national partnerships for the Red Cross, and she. First of all, she was really, really good at what she did. And secondly, she was one of those people who, like many of what I would call the folks who really invest, not just in the Red Cross as a job, but as the Red Cross as a mission, she was thoroughly invested in a big way and was constantly called upon to be in very difficult places and very tough circumstances, and to represent the Red Cross and its work in, hurricanes and disasters and tragedies of one kind or another, and all the way from single household or apartment building fires to mass shootings at different places around the country, and she did it all with an enormous amount of grace and empathy, and it's. Look, you hate to see anybody die of a disease or an illness, whatever it is, at the age of 51. But the Red Cross and a lot of the people who are served by the Red Cross are really going to miss her.
Thanks, everyone.